Hello, my name is Katie Clark, and I'm a student from Palm Beach Atlantic University, class of 2018, and I'm going to Duke University to be a pediatrics nurse. For me, getting my job at Duke University took a lot of time and motivation and determination. I began with filling out the application and making my resume, and then I went out to a Duke hiring event, which is an incredible opportunity for any hospital to take advantage of those hiring events. It's a great way to connect with the managers, also a great way to hear about different opportunities in nursing and to learn more about nursing. I learned that there's more than 4 or 5 different types of nursing in one hospital, that there's numerous and various types of nursing. So after that hiring event, I got an interview there, and I sat with the nursing manager for the float pool, and she just asked me what I was passionate about, what I enjoy doing, and she loved the fact that I'm willing to get up and start something new. That was one of the things that really stood out to her, because being a part of the float pool, you had to be able to adapt to whatever your circumstance is. So then I had that interview, and then there were a few other units that had talked with me at the hiring event, and I had set up some interviews to go back up to Duke and interview with them. So whenever I went back up to Duke to interview with the nursing managers, you also shadow. Shadow means you go onto the unit, you are kind of precepting with an employee who's already there, and you just observe what they do, what happens on that unit. You learn a little bit about that unit, ask questions, and it's just a great way to see if you really fit in or if that's something that you're gonna enjoy. And then I had a 30-minute to an hour interview with the manager as well. And then you wait a few days or even weeks to hear back if you got the job or not. And so then you also have a follow-up call, and just to explain what it is that you're going to be doing to make sure that you understand what is going to be happening if you take this job.
Okay.
During my interview, they did not ask any problem-based or scenarios of what might be happening, what would you do. The interview really focused on how I manage stress, how I work with other people, explain a time that you struggled with one of your patients and you had to figure it out because this patient was not being cooperative or was just complaining about you. How did you handle that situation? I had a lot of scenarios in that sense, how you handle things then in regards to if you have a patient who is crashing, what are you going to do? So it's more personality-based questions and behavioral-based questions than critical thinking questions with nursing.